For 2 years now, almost, we've been dealing with this pandemic, but a lot of people are feeling some level of relief for a couple of different reasons. One is, it is indeed true that Omicron is more transmissible, but it's also less deadly, so the fear factor is lower in terms of ending up in the hospital or having high mortality rates as a nation again. The other reason is that we now have the science for vaccinations, boosters, and we also have a great level of natural immunity. At a minimum, we have 1 in 5 Americans who had some level, one of the variants of SARS-CoV-2. Most diseases in the past have eventually kind of burned themselves out. The example like the Black Death, where so many people got infected and died that the disease eventually killed itself out, or you have the other situation where the disease tries to infect a lot of people and in doing so becomes less deadly. And that does appear to be the trajectory of Omicron and SARS-CoV-2 for us now. And that is the best case scenario. There are other examples like HIV, Ebola, and smallpox that have not become less deadly over time. We've just learned how to deal with it. With HIV, either through expensive treatments. Ebola, we basically just use the old-fashioned quarantine, or smallpox through vaccination. And remember, vaccination has also been very effective with the other type of disease, the 1918 pandemic, which basically started the whole flu regimen that we've been using for roughly 100 years now. And this SARS-CoV-2 is basically our century's version of that. For now, because of the vaccinations and the boosters and the level of natural immunity that we have in this country, I'm going to be optimistic, both for the disease and for the economy overall.